Welcome to Jersey Matters. I'm Larry Menti. The Delta variant has a grip on New Jersey. What does that mean for the fall? We'll talk with the CEO of University Hospital in Newark, Dr. Shareef Elnahal. The eviction moratorium is expiring in New Jersey and across the country. Matt Shapiro, Executive Director of the Tenants Association, is here with what you need to know. Jersey Shore businesses are hard hit by the hiring crisis and making a desperate plea for workers to come back. And my commentary on why we should free Britney. Hello, and welcome to Jersey Matters. I'm Larry Menti. Glad you could join us. Let's get right to my interview with former health commissioner, now CEO of University Hospital in Newark, Shareef Elnahal. Doctor, as always, thanks so much for your time. I know you've been looking at the numbers across New Jersey, the rise in cases because of the Delta variant, as well as numbers across the country. What are you looking at now? What do you believe is happening?
Well, what we're seeing, Larry, is unfortunately something that's not surprising and is a direct function of simply not enough people in our communities vaccinated yet. We are among the top states in the country for vaccination rates, which is something to celebrate and recognize. But remember, we're going to keep experiencing these peaks and troughs, these surges in cases, these increases in hospitalizations until we reach something called herd immunity, one way or the other. You can get there in two ways. One way is if you vaccinate, which is much lower risk to you and safe and effective, or you can wait until you get COVID-19, wait until enough people in the population get COVID-19, which comes at a significant cost to human health and human life. And so the Delta variant is not going to be the last variant that we see. We're seeing new variants form literally every week around the world. We should consider ourselves fortunate that the Delta variant is responsive to antibodies generated from the vaccines. In other words, the vaccines are effective in preventing severe infection and hospitalization and death from the Delta variant. But that may not be the case for the next variant, which really impresses upon all of us the importance of stopping the spread in the first place before these variants form.
Pfizer has come out and said that they would love to give a third shot, that they think it would be more effective if people got a third shot. I read that you weren't impressed with that.
Well, my comments before were around prematurely talking about a booster and what that could possibly do for vaccine confidence. And I don't think it helps vaccine confidence for folks who have not chosen to get the shot yet. However, just in the last couple of weeks, there are scientific reports and investigations that do seem to be pointing in the direction of a need for a booster. First of all, Israel released data showing that the effectiveness of the Pfizer vaccine, and they exclusively used Pfizer in Israel, does wane over time. It's waned after about the first 6 months of their vaccination campaign, and that's an important variable. And you are seeing more hospitalizations there, even among vaccinated people. While very rare, they are increasing. And secondly, there are other reports out of the United States, and of course the studies that Pfizer seems to be doing that do seem to be pointing us in this direction. So I don't want to speak ahead of the CDC or the FDA. That's another important point. We have to wait until the impartial scientific authorities and the public health authorities weigh in on this. But I do think that will be the direction we go in.
And you seem that your opinion on it has evolved, that you're more likely to say it's a good thing.
At this point, yeah, it's definitely evolved with the science and with the data. So before I was really trying to make sure we waited for that data before saying we needed a booster and not necessarily take pharmaceutical executives' word for it. But I do think that the data is starting to arise and it is pointing toward the direction of the need for a booster.
Some of these statistics that have come out about communities of color, African Americans, Hispanics from LA. There was a poll out today in Philadelphia that the lowest vaccinated population are Black Americans, with only 49% in Philadelphia, and many of them saying they will not get vaccinated. I know I've talked to you before about an outreach program to communities of color. It doesn't seem to be working, does it?
Well, I would argue that it's working in our community, Larry. So A couple things that are making me say that. The first is people are still getting vaccinated in Newark. So we've had targeted outreach, making sure we address the community humbly with the understanding that the history of medical racism, but also the experiences of so many people of color at the point of care around implicit bias, not taking their symptoms seriously, et cetera, that is all coloring folks' opinion on whether they should be vaccinated. But if you approach these conversations validating those concerns and recognizing them, you can dispel myths and misinformation pretty easily once you're a person of trust and you have that person in a trusted conversation. So we're proving that every day with canvassing that we're doing door to door for mobile vaccination events. This is just a few minutes of people's time. And we are getting them through the journey of wanting to get vaccinated. We've done over 1,000 shots with mobile vans across the state, including in our region right here in Irvington. And I do think that the data supports that people of color are more movable on this issue than other demographic groups, especially because their number one concern is around unknown side effects and adverse events. But the problem, Larry, of misinformation and disinformation seems to be the biggest barrier we're contending with now. Being a trusted person with credibility addressing those conversations really helps.
Yeah, it seems like, well, I shouldn't be surprised, but I am. It seems like everything is political these days. It's become a political fight, and you can comment on that. But also, speaking of that, there are some new recommendations by the CDC, and there is talk about children having to wear masks when they return to school. This is a political year in New Jersey. Do you think that's going to happen in New Jersey?
Well, I can't comment on what the governor's thinking, what the health commissioner's thinking. I think they have the most data in front of them, including the CDC's thinking on this. But here's what I would advocate for. You have now, I have 3 kids, 5 and younger. They're going to be going to school. My daughter's entering kindergarten in the fall. She's unvaccinated because she can't get vaccinated yet. And she's going to be surrounded by other children who are the same. And so I know that the Delta variant can much more easily spread among everybody, including children, and the fact that we're seeing pediatric increases in cases across the country. This is a phenomenon that's been reported on over the last several weeks. So I don't want my kid to get the Delta variant, and nobody should want their kid to get the Delta variant because that can cause problems, despite the misinformation you hear about this being harmless to kids, not necessarily. And so for safety and for health reasons, I do very much agree with the CDC's recommendation.
So you would like to see it happen. And I'm going to push back a little bit because you said you don't know what they're thinking. You were the former health commissioner. I believe you were a friend of the governor's. This would be an extremely difficult position for him in an election year. Don't you agree?
Well, what I can't comment on, Larry, is the political considerations or all the other considerations on his plate. My viewpoint is public health. My viewpoint is running a hospital that still seeing COVID cases every day. And so my recommendation based on public health and medicine is that masks are necessary in schools until we get a hold of this pandemic and we get enough people in the community vaccinated. There's another separate question about whether vaccinated kids, adolescents, and older should still have to wear masks, knowing the most recent information about the fact that vaccinated people can carry high viral loads or viral content in their bloodstreams and in their bodies. It's important to respond to that. And that was the recommendation of the CDC ultimately, to have vaccinated people wear masks in areas of the country where it's spreading in a significant way. And that includes certain parts of New Jersey. So I don't think it's an unreasonable recommendation.
I told you before we started the interview that I talked to Dr. Brian Strom from Rutgers, who is the executive vice president in charge of health affairs. And he predicted 3 weeks ago that we were going to have a spike now. He said, watch, in 3 weeks, we're going to have a spike. And we interviewed him again. And he said that because of the July 4th gatherings. He said some of the stuff is extremely predictable. Does that mean, do you believe that the spike happens and now it'll subside, or because more people were infected, it will continue to rise?
Well, if you look at the slope, Larry, of what we're seeing in cases now throughout the country, that curve does not look like it's plateauing. So I don't think we are closer to the peak than we are to the beginning of the spike. I think the spike is going to continue for quite some time. And all the projections I've seen for New Jersey around what hospitalizations are likely to look like through October, November, only show an upslope at this point. And so I'm concerned that folks are thinking, well, it was because of one holiday or another, and we're not going to have another holiday for quite some time. I don't believe that's the case. I think people are continuing to spread this disease in our communities, primarily among the unvaccinated. So I will always end at this point with an appeal to get vaccinated, because that is our fastest and best way out of this.
Yeah, I don't know how you can make that appeal. It doesn't seem like people are listening. Does it seem like we're not getting the right voices asking people to get vaccinated?
I do think that the Surgeon General's advisory on misinformation and what folks can do about it, but also other evidence and studies show that your best option here is interpersonal, in-person interactions with folks who are hesitant. And across the table, it has to be somebody who is trusted. So ideally, a medical professional, a doctor, a healthcare provider, a nurse practitioner, a PA, whoever sees you for your primary care, should be the person you have that conversation with. They have the credibility, they have the knowledge. And if it's not that person, it should be somebody with credibility in the community who actually understands the science and the data and can speak to some of the very important questions that people have. And again, we are having these conversations successfully, albeit slower than we would have hoped. But I still do think there is room there to make progress. So I'm not giving up. I think, again, the closer to the community you are and the more interpersonal the conversation is, the better.
If this doesn't happen, you're saying we're not plateauing right now. If it continues to rise, and in September, people go back to schools, they go back to the universities, they go back to work, what do you see happening?
Well, that's one of the major drivers in the modeling on why cases are only expected to increase over the next several weeks. If plans don't change about return to work and other sort of establishments that folks can go into in high numbers, indoor without vaccine verification, without mask mandates, then you're going to see an increase in cases and hospitalizations. This is a virus that is now much more predictable than it was before. And when the chancellor spoke with you, he was right, because we've seen this now for more than 18 months. And so we do expect this to get worse if nothing else changes.
And what does that mean exactly? If it continues to get worse, another shutdown?
We may be in a place where we have to worry about hospital capacity again. And we're very prepared for that at University Hospital. Our pandemic team has a surge plan for both staff and where to put patients and 90 days worth of PPE. But the one thing we can't control and prepare for is how much this spreads in the community. And so I don't know if we're going to need another set of restrictions along these lines. That all depends on the data and what we see. But I'm concerned that we may get very close to there, if not reach that threshold, because of what we're already seeing now in terms of increases in cases.
You've mandated your workers get vaccinated. How is that going?
It's going okay so far, Larry. So what's interesting is that in addition to doing these mobile vaccination events where we're having these conversations, I've had personal lunches with unvaccinated healthcare workers in my hospital to directly hear from them about what their concerns were. And it's funny, I just had one of those lunches last week. Within 7 days, almost everybody in that room ended up getting vaccinated, because I've done as much as I can do to earn their trust since the beginning of this pandemic and before, dispelled some of the myths that they had read on Facebook and social media, and they ended up being convinced and getting the shot. And so I do think we will have a scant few that end up not having an exemption and not taking it. The numbers will mature when they do on that. But we've made incredible progress, now approaching 90% even before the deadline of our employees vaccinated. So I'm very optimistic.
You know, you seem like you have such a reasoned, unbiased, and effective approach to this that doesn't seem like it is happening across the country in many cities and even in Washington. I know you were part of the transition team with Joe Biden. Have they tapped into you for any advice on this?
Well, I was really grateful to serve on the transition team for the agency review team for the Department of Veterans Affairs. I worked in the Department of Veterans Affairs before. It's where I learned how to be a leader. I think it's one of the most important missions in this country, and stand ready to continue to help. And I have here and there for different things. The Biden administration has an approach to this pandemic that is real, it is science-based, it is serious, and they are assisting areas of the country, regardless of political affiliation or whether they won, the president won those states or not. They are sending surges of teams to help folks now, and that's something I personally admire and appreciate.
You seem like you've done so well in Newark and at University Hospital. I just think that they could use your advice. I guess we'll both wait by the phone to see if that happens. Thank you, sir, as always, for spending this time.
Thank you so much, Larry.
Shareef Elnahal, CEO of University Hospital in Newark. Still to come on Jersey Matters. How do you convince a loved one that he or she should get the COVID-19 vaccine? We ask one of the top psychiatrists in the country next.